my name is Mary Fritchman. I'm doing a physical assessment on Anna Moore, the patient. First, we provided privacy. We have adequate lighting, and I'm going to perform hand hygiene. While Anna was coming in, I watched her gait, and she had a nice balanced gait. It was equal, good range of motions. Now she's sitting here. She doesn't seem to have any involuntary tics or twitches. Her hygiene is good. She has a good smell. She looks like she showered today. Her clothing is appropriate for the weather outside. I'm going to take a look at your hand. With this, I'm assessing her skin. It's warm, dry. Her nails are clean and well kept, and she's got a good capillary refill, less than 3 seconds. Okay, and then her affect, her mood is appropriate for this situation. She's got nice facial symmetry. Can you give me a big smile? And then she's got a symmetrical smile as well. Now we will move down to the head. She has good eye contact, and when you're first talking with the patient, you can assess some orientation questions. So, do you know what day it is today?
It's February 19th.
Okay, and do you know where you're at?
The College of Nursing.
Okay, and why are you here?
For our health assessment videos.
Okay, so she is oriented ×4. I'm going to come in and I'm going to touch your face now. I'm going to palpate your temporal pulse, okay? Okay, and then it's +2 bilaterally, and then I'm going to go down and palpate your temporomandibular joint. And do you have any pain or crepitus with that? Okay, that's normal. And then I'm also going to inspect her sinuses and see if there's any tenderness. Any pain or tenderness with that? Okay, and then also to conclude the head, we're just going to inspect for symmetry. And then also while you're doing that, you're looking for any lesions, dryness, redness, bumps. So we will move down to the eyes. So we will first start out with the confrontation test. This assesses your peripheral vision. I'm going to come from behind and wiggle my fingers and then just indicate when you can see my fingers, okay?
I can see them. I can see them. I can see them.
Okay, so her peripheral vision is intact. Next we can do the corneal light reflex. So on this one we will shine a light into her eyes. Make sure it's on. And what we're looking for here is to make sure that the light reflects off of each cornea at the same spot in her eyes, in which they do. Next we can test for the 6 cardinal gazes. This tests for cranial nerves 3, 4, and 6. So just without moving your head, I want you to follow my finger. So. Okay, and so she didn't have any trouble with her movements on that. Next, we will do the cover test. I'm going to cover one of your eyes and have you stare at my nose. What we're doing with this is we're assessing for any intraocular muscle weakness. And so what you'll see here is after you cover one eye for a few moments and then pull away, if she had any weakness in her muscle in her eyes, that covered eye would drift, and you would notice because whenever you pulled your hand away, the eye would kind of refocus and zip back into place. So we'll do this on the second eye as well. Okay, and so it doesn't appear that she has any muscle weakness in her eye. Also, you could do the Snellen eye chart right now, which you'd have the patient face the Snellen eye chart 20 feet away, cover one eye, and then go from the smallest line they can read up and check their vision that way. 20/20 is just the standard normal. So now we will look in your eyes. When we do this, we're checking for pupillary reflexes. We shine the light into each eye twice, and when we do this, we're looking for first the eye that you're shining the light into to see if the pupil constricts with the light, which hers does, and then look at the opposite eye, and the opposite pupil should also constrict when you shine the light into the opposite eye. Also on the eye, you want to look for, at the external structures, you want to look for any drainage. You want to note the color of her sclera and her conjunctiva. She doesn't appear to have any drainage. Her sclera are white, and to pull down her conjunctiva are pink, so this is normal. And then also, to look at the cornea to make sure that they're smooth, you can come in at the side, and hers are both smooth. And now, let's see. Oh yeah. And then we'll do accommodation, so I'll just have you switch between staring at my nose and my finger, and what we're looking for here is, normally the pupils would constrict when looking at an object closer to them and then dilate, looking at objects further away. So first stare at my finger, then at my nose, then at my finger, and then at my nose. And Anna's eyes does all of these things. And also, you should make note of what size the patient's pupil is. So hers is about 2 millimeters, which is normal. On to the ears. First, we'll expect the outside. They are equal bilaterally. She does have some piercings. We want to make sure that she's cleaning those, and it appears that she is. There's no crusties or drainage. Then we will palpate, and I want you to let me know if you have any tenderness. Okay, so then next we will go and look at her ear canal with the otoscope, and then what we're looking for is we're going to look at the canal itself, note the color, and then look at the tympanic membrane. So on adults, you pull the pinna up and back. Okay, and then we'll do this on both sides. Okay, and her ear canals are clean, pink. There's no excessive amount of serum in, which is earwax. And her tympanic membrane is a nice pearly white. If you notice, I didn't stick the needle all the way into her ear. Normally I would, but I'm not sure how clean this one is, so we're not going to contaminate. Now we'll do the whisper test. I'm going to come behind you, and then first I'll have you just kind of occlude your left ear. I'm going to whisper a 2-syllable word.
Apple.
Okay, and then I'll do this on the right.
Baseball.
Okay, so there is no hearing loss there. And then next, we will move on to the nose. We will look for symmetry. Her nose is symmetrical. Her nostrils are symmetrical, and then we'll just shine a light in. There's a little bit of, it's not quite red, but it's pinker than normal, so are you having any drainage? Okay, so probably starting to get a little bit of a cold. So that's normal, and then I'll have you plug your nose, and then inhale, and then plug and inhale. Okay, so they're patent on each side, and then we will go to the mouth. So I will just have you open your mouth for me and say ah, ah, and then lift your tongue up. Okay. And so what we're looking for here is, you're looking at the buccal mucosa, the gums, the teeth, the uvula. So whenever she says ah, her uvula went up, so that would indicate that her gag reflex is intact. And then also you're assessing the tonsils, and her tonsils were about 2+, which is normal. And then I didn't see any lesions. Her teeth were white and clean, straight. So next we will move down to the neck. Her neck is symmetrical. We can palpate the cervical lymph nodes here. And you want to do it lightly. You don't want to push too hard, because if they are inflamed, then it'll definitely hurt your patient. And then we'll move down the neck, down the sternocleidomastoid muscle. These can run a little bit deeper, so I'll have the patient just kind of tilt their head towards the side that you're palpating, which will relax that muscle. And if you're able to feel any lymph nodes, then you'll feel those. I could not feel her lymph nodes. Her tonsils, her right one was a little bit more swollen than the left, which is normal if she's fighting off an infection. Next, we can come down. You've got some cervical lymph nodes here, and they're deeper. You don't really feel those, so I couldn't feel those, and that's normal. Next, I'm going to palpate her thyroid gland. So I'll come from the posterior approach, and just first I'll have you swallow. Okay, so when I have her swallow, I can feel her trachea go up, and then I also know that I'm in the right area of the throat. So I'll just displace slightly with my left and palpate with my right. And do this on both sides. I couldn't quite feel her thyroid, that's normal. What you're looking for is any goiters, any lumps, and tenderness. Do you have any pain and tenderness? Good. And next you can palpate the carotid pulses. And you want to do this one at a time, because if you do it two at a time, you can cut off some of the oxygen supply and cause your patient to become dizzy, which is not good. So that concludes the head and neck assessment. Next we will move down to the chest. So we're going to look for symmetry. Her shoulders are symmetrical. Oh, and then did we do range? I don't think we did range of motion with the neck. So just tilt your head to your chest and then back and then each ear. Okay, and do you have any pain or tenderness with that?
No.
Okay, now moving on to the chest. Her shoulders are symmetrical. We're watching her respiration rate. You can come to the back and you can palpate. You can palpate for any masses, tenderness. You have any tenderness with my palpation? Okay. Next we will do, what's that called? Percussion, sorry. Alright, and with this one you want to be sure to stay away from any bony prominences, because that will create a dull sound. Alright, and then we will listen for any adventitious breath sounds. So we'll go through the fields on your lung, and Anna, every time I place my stethoscope on your back, just take a deep breath. And Anna's lungs were clear to auscultate bilaterally, which is normal. Any adventitious sounds would be like wheezes, crackles, rhonchi. And next we can auscultate for any consolidation, and we'll do this with, there's a few tests for this. So you can do the whispered pictoriloquy. This is, you'll have the patient whisper 1, 2, 3, and then kind of slightly stand to where you can see them move their jaw. So just every time I place my stethoscope, just whisper 1, 2, 3. Okay. So I could not hear her say 1, 2, 3. This is a normal finding. If I were to be able to hear her whispered 1, 2, 3, then that would indicate some consolidation. The next test is the bronchophony, And this one I will have you say 99 in a normal tone every time I place my stethoscope on your chest.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and this is a muffled sound, which is normal. If you were to be able to hear clearly through your stethoscope, that would indicate some consolidation as well. So lastly, on the lung fields, we'll do egophony. So this, say the E sound for me every time I place my stethoscope. What you're looking for here, the abnormal finding was if instead of hearing an E, you would hear an A. So
E, 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 E.
okay, and so I heard a clear E sound with each. So we'll move to the anterior chest now. Normally we would auscultate breath sounds on the anterior chest as well as posterior, but for time purposes we aren't. And you'd also do the whispered pictoriloquy, the bronchophony, and the egophony on the anterior too. But for time purposes, I'm just going to listen to your heart on your anterior. So we are going to listen to all four of your heart valves. We're first going to start out on your right side of the chest. This is your aortic valve, and then you'll go to, that's your right sternal border on your second intercostal space, and you go to your left sternal border on your second intercostal space and listen to your pulmonic valve, and then down to the third and fourth intercostal space, that would be your tricuspid valve, and then your left sternal border mid-clavicular line, fifth intercostal space, that would be your mitral valve. What you're listening for here now are your normal S1 and S2 sounds, some abnormal sounds. The S3, S4 could also indicate a valve problem. Also with a valve problem, you could hear any murmurs. In that case, you could switch to the bell side of your stethoscope and help listen to those softer tones. Also, you're listening for the apical pulse, your rate and rhythm. Her rhythm was normal. Nice, even. So that concludes our assessment.